Well, thank you very much, and appreciate this opportunity to discuss a little bit of healthcare. I come at this at really two perspectives. One, as a team member at Orlando Health, but also a member of the Florida Senate, and I sit on the Health Regulation Committee. And so a lot of the issues that we're looking at, I'm sure most of you as small business owners are looking at too. The reality is that there's probably 5 or 6 different proposals in Washington that could drastically change healthcare in this country, how it's delivered, how it's administered, whatever it may be. And that raises some, to me, as an employee, but also as a parent, as a senator, raises some concerns for me. We recently, the state of Florida, did a report, ACA, the agency for our healthcare agency, looked at the proposal, at least the U.S. House proposal, and they believe that if that were to be implemented as is, that the taxpayers of the state of Florida would see an additional cost for Medicaid of about $1.5 billion to cover the additional individuals that would potentially be covered. That raises a considerable amount of concern, because the reality is with Medicaid and Medicare, you know, in a lot of ways we already have government health care that's administered by the government, by the state of Florida. And a lot of the factors that we deal with, or Orlando Health as well as with the state, you could see something very similar if there were to be another public option that were potentially be offered. One is, you'll hear people say, well, we're not going to cut care, we're not going to cut coverage. But what ultimately could happen is the cut in the reimbursement. And the reimbursement to the doctor, to the insurance company, whatever it may be, will ultimately have an impact on the distribution of that particular health care. So that's one area that I have serious concerns about. The second area that we're watching, we deal with a lot of small business owners. Of course, the Chamber of Commerce does. One of the proposals calls for essentially a payroll tax, that if you are at a specific level and you are not offering insurance coverage, that you would be assessed a payroll tax. Number one, I'm not sure that that's a good idea in a down economy when we're finally starting to see the uptick and the turn, that you're going to then put a tax on everybody. But the concern is that there are some businesses, some individuals that self-insure, that will say, you know what, we'll take the penalty and we'll just move all of our employees into the new government plan. And that's a significant amount of concern. All of these issues, obviously, some of it is just what you read in the paper because there's so many different proposals, there are different things that come forward. There are a lot of things that have been mentioned that I completely agree with. You know, we should have incentives for individuals that are living well and they're a good client to insure. There ought to be an incentive for that, and there ought to be incentives for businesses that go out and say, we're going to offer insurance not just for our full-time but our part-time. You know, we need to provide an incentive, and it's something that we're looking at. There are also some overlying factors that I think we all need to remember. You know, most recent polling shows that 85% of Americans are very happy with their healthcare system. They're happy with their doctor, and they're happy with their insurer. It's that group of, about 30 million, I think, of uninsured that is an issue. And 17% of our economy is healthcare. And when you're looking at trying to turn the corner and get back on your feet, do we really want to completely rewrite how we do healthcare? We really need to be slow about it and deliberative. Not only is healthcare about providing good healthcare, but it's an economic engine. Orlando Health alone in Central Florida has a $3.8 billion impact on our community, over 13,000 employees. And when you start talking about potentially changing how we administer healthcare, then you also get into discussion about jobs. So it's something that we're definitely going to keep an eye on. I would tell you just one last point, because I don't want to go too long. When people talk about a government-run healthcare plan, and if there really is going to be a government plan that's offered to everybody, I would encourage you to do a little historical perspective about property insurance in the state of Florida. In the state of Florida, right now, Citizens Property Insurance is the largest insurer of property in the state of Florida. Government-owned, taxpayer-paid, backed up by the taxpayers. We consistently have tried to get out of the property tax business, but that has not happened. A major hurricane in the state of Florida will cost billions and billions of dollars to the taxpayers of the state. They directly compete against the private sector. They undercut the private sector, and in many ways have run the private sector companies out of the state. Perfect example is State Farm. So I'd be more than happy to talk more about that because we've had that's an ongoing battle in Tallahassee. May be better for a different forum.
Thank you, Cynthia, and thank you for inviting me today. It's nice to be here, and it's nice to see that there's so much interest in this topic. If you would indulge me for just a second, I'd like to ask Bea Koheiser, who is doing a great job running our Central Florida operations, to stand. If you haven't had a chance to meet Bea, I hope you'll have a chance to meet her today. So glad you could be here, Bea. You know, we've heard this morning a lot about where the industry is, and we all know that it can be improved, but I would say that we're making a lot of good progress, and we're glad to be a part of it. I'm going to start out with a little quiz, get you thinking a little bit. Cynthia had asked me if I would talk about Solantic and retail clinics. So I want to know if anyone knows how many retail clinics there are in the state of Florida. Someone will take a guess. Carl, Steve? Guess.